is Dr. Georges Benjamin. He's the Executive Director of the American Public Health Association. Thank you very much for your time, Dr. Georges. Now, there are calls, of course, as we just heard from Dr. Fauci there, to take monkeypox more seriously. What aspects are the most worrying in your view, do you think?
I think the real concern that we have is that we've got a lot of COVID fatigue, which I think is bleeding over to people saying, gee whiz, we just don't want to have to deal with another infectious disease. But this disease is significant. Anyone can get it. And I think what's important to know is that, any kind of person-to-person contact, you can get the disease, and you can get it from, bedspreads and, sheets and clothing. So the fomite spread, meaning you get it from an inanimate object, is significant with the spread of this disease.
You mentioned COVID fatigue. Is that perhaps part of the reason why there aren't enough vaccines, testing, treatments to keep up with the virus spread? Is it partly because it's in the shadows of this more serious coronavirus?
No, I think the fact is it's a disease that we haven't had to deal with. The last significant outbreak in the United States was in 2003. That involved 6 states and maybe 50 people. Now we have a disease which is, impacted over 2,000 people in the United States. The good news is we've not had any deaths yet, but it is truly a significant disease, and we just didn't have enough vaccine readily available. But they are ramping it up. But that is still a vaccine shortage.
Dr. Fauci said that there was something unusual about this particular disease. It's also been noted that it can sometimes leave permanent damage. Talk us through some of the consequences of monkeypox and how it can manifest if it's left untreated.
Well, permanent scarring, you get a significant rash, and that scarring can involve skin, it can involve your eyes. It is a disease that again, you can get from one person to another. The real challenge with this disease is that it can take over 20 to up to 21 days before you actually know that you're infected, so that you can get significant spread throughout the community from the disease before you even know you're infected.
As you mentioned, this is fairly new for the United States, but monkeypox outbreaks have been occurring in parts of Central and Western Africa for years, and researchers there have been frustrated that resources have been limited for their countries. Are Western scientists behind in terms of trying to understand this disease, and have they not been lending on the researchers in these African countries to try and find out more?
This is an example where we have not paid attention to what's happening outside of the western part of the planet. And, we have these diseases, we call them neglected diseases, and they have been neglected. And we need to pay a lot more attention to them, because a disease anywhere is a risk to all of us everywhere.
Interestingly, though, in the scientific literature, only sort of a few thousand cases have been reported since the 1970s. Why is this disease spreading so rapidly now?
Well, that's a good question. The outbreak in the United States several years ago was truly a zoonotic disease, meaning the people that got it from an animal. It was because of a Gambian rat that was brought into the United States illegally. It infected prairie dogs, and then the people got it because they handled the prairie dogs. What makes this one very different is that it is a robust person-to-person spread. Now, we've known that you can get this from another person. Person-to-person spread is not new, but the speed in which it is moving through the community is what is of most concern. And I think, as you pointed out earlier with Dr. Fauci's comments, the fact that we have waning immunity from smallpox, which kind of protected us from this particular kind of virus, which is in the same family of viruses, pox viruses, is probably one of the reasons that we're seeing this massive outbreak worldwide.
All right, Dr. Georges Benjamin, thank you very much for your time there.
Thank you.